Okay, so our case dealt with a 64-year-old man with progressive leg weakness, recurrent falls, and anemia. About 8 months before his admission in the clinic, this patient began to experience fatigue and leg weakness. He was someone who used walking as his daily source of exercise, usually being long distances. Being a daily walker, the patient noticed the distance he was able to walk became progressively shorter and had to take frequent breaks. His symptoms continued to worsen when about 5 months before admission, he developed intermittent paresthesia, which caused tingling and a decrease in sensitivity in his feet. About 4 months out from admission, he lost his 2 lower teeth. The teeth naturally fell out and was not caused by trauma to his face. About 3 months before admission, the patient fell and went to his primary care doctor. During his visit, the patient noted that he had 3 months of increased alcohol consumption, which totaled to about 6 to 7 glasses of wine per night. In addition, the patient also noted they had several months of reduced food intake that resulted in extreme weight loss.
So the patient had an extensive medical history, which included atrial fibrillation, which is an irregular heartbeat that can result in syncope or passing out. He also had hypertension, gout, osteoarthritis of the knees, gastroesophageal reflux disease, Barrett's esophagus, and a Roux-en-Y gastric bypass, which is also generally known as a bariatric surgery, and it's a type of weight loss procedure. It's important to note that the Roux-en-Y procedure causes a predisposition to the development of a high blood alcohol concentration, and alcohol use disorder can occur in patients that have no history of excessive drinking. Additionally, he was divorced, lived alone, and both his father and brother passed away from esophageal cancer.
So when he went to his primary care physician, he underwent a physical examination. He had normal vital signs, but the patient did have discoloration on his skin from bleeding. During a mouth exam, the primary care doctor noted areas of gingival bleeding where his teeth had fallen out. When the patient did come to the clinic 3 months later, he underwent another physical examination. He noted that he had fallen 2 days prior. He had mild pain above his left eye, along with bruising. He confirmed that he had hit his face when he fell. As part of the routine examination in older adults, his leg strength was tested. During the motor test, his strength was 3 out of 5 bilaterally on his hip flexion and 4 out of 5 bilaterally on his hip extension. The patient was unable to raise from a seated position by himself. The remainder of the physical examination was normal, but his perception of pinprick was diminished from the toes all the way to above his knees, showing that he had lost feeling in his lower extremities. Also, the patient had diminished perception of light touch on the plantar surface of his feet and toes. All the patient's reflexes were normal, and the rest of the examination was normal.
Diagnostic procedures included laboratory blood testing that could be seen on the right, which revealed deficiencies in multiple vitamins and minerals. The test specifically showed extremely low levels of folate, vitamin B6, and vitamin C, mildly low levels of zinc, and low end of the normal range in levels of copper and selenium. The patient's alanine aminotransferase and aspartate aminotransferase, which are 2 liver enzyme levels, were elevated, and the elevation in these levels can be seen in chronic alcohol consumption. The red cell count, hemoglobin level, and hematocrit level were all decreased, which indicates anemia. These low levels could be related to his malabsorption problem from his gastric bypass. The testing of these specific vitamins and minerals were a result of his history of the bariatric surgery, which the most common deficiencies are in calcium, vitamin B12, and vitamin D, and iron. And other potential relevant vitamin levels that were not obtained, like vitamin B1, vitamin A, and vitamin E, could have been revealed with further blood testing.
So there are 2 different diagnoses being examined for this patient. The first one is the cause of his recurrent falls, and potential cause of this could be him being an older patient, could be due to orthostatic hypotension, his alcohol use, or nutritional deficiencies. The second diagnosis being evaluated is the cause of his lost teeth and gingival bleeding, and the diagnosis for this is potentially scurvy. So for falls in older patients, basically as patients get older, maintaining balance can become a struggle. Maintaining balance is dependent on strength in the hip flexor and glute muscles. And this kind of strength gradually decreases with age. As we saw with this patient's clinical presentation, he did not have full strength in his hips, and he also had osteoarthritis in his knees. And pain in weight-bearing joints, such as knees, can also increase the risk of falling. The next diagnosis in falls is due to his orthostatic hypotension, which is a drop in blood pressure when going from a seated to standing position, causing lightheadedness and dizziness. One of the main causes of orthostatic hypotension in this patient is its side effects from medicines. The patient was receiving antihypertensives and diuretics, which may have been causing his falls. One of the most alarming aspects of this patient's clinical presentation was his alcohol use, as he was consuming 6 to 7 glasses of wine per night. As noted before, this excessive use of alcohol and high blood alcohol levels can lead to alcohol-induced neuropathy, which may be causing his paresthesia in his feet. On top of this, the rapid weight loss he was experiencing may be causing his leg weakness. Both of these conditions increase the risk of him falling. This patient was also at high risk for nutritional deficiencies due to his decreased intake of vitamins and minerals, due to his excessive alcohol use. In addition, the patient had a decreased absorption of vitamins and minerals due to the bariatric surgery he underwent. After surgery, he was prescribed vitamin supplements, which he took, but he was not taking the recommended multivitamin, which included vitamin C and vitamin B6. He was also not taking folic acid supplements. Deficiency in folic acid has been linked to a slow, progressive, and sensory-dominant pattern of peripheral neuropathy. However, the patient's deep tendon reflexes were normal, which is an important finding as it argues against most causes of peripheral neuropathy. Again, the most concerning aspect of this patient's presentation was his alcohol use, which affects his peripheral neuropathy as well as his intake and absorption of vitamins and minerals. The other aspect of this patient's clinical presentation was his lost teeth and gingival bleeding. This patient was at high risk for bachelor scurvy, which is a condition among unpartnered men who prepare their own meals or eat out frequently, drink heavily, and eat virtually no fruits or vegetables. Scurvy has been known to be caused by a vitamin C deficiency, which is present in many fruits and vegetables. Again, the patient's alcohol use and bariatric surgery affected the absorption of vitamin C in his stomach. These causes and his orthostatic hypotension, bruising, and progressive fatigue are all consistent with the diagnosis of scurvy. Additionally, vitamin C deficiency in scurvy could easily explain his persistent orthostatic hypotension because the vitamin C is needed to activate the alpha adrenergic receptors, enhancing its activation by epinephrine. Also, the clinic stopped providing the patient with blood pressure medication when the patient was admitted, including diuretic medicine, which gets rid of fluids via urine, which in turn decreases blood pressure. However, the patient still had orthostatic hypotension, which suggests the diagnosis of scurvy. So the final diagnosis for this patient was a vitamin C deficiency, which caused both scurvy and progressive weakness, which led to his frequent falls. From the blood test, it was found that the patient had micronutrient deficiencies, which caused both peripheral neuropathy and anemia, which is a condition in which the body does not have enough healthy red blood cells. The patient was also diagnosed with an alcohol use disorder, so the recurring falls mainly stemmed from a vitamin C deficiency and the alcohol abuse. And it seems like the main underlying cause of this patient's diagnosis was ultimately due to the bariatric surgery, which led to a malabsorption of vitamins and minerals, which ultimately caused scurvy from vitamin C deficiency, anemia from iron deficiency, as well as peripheral neuropathy from folate deficiency and alcohol consumption. The vitamin C deficiency could also explain the patient's orthostatic hypotension and loss of vascular tone.
The treatment for his scurvy was fairly straightforward. It included the addition of vitamin C to his diet via fruits and vegetables, and he was also administered vitamin C supplements. Additionally, he was offered counsel on unhealthy alcohol use. However, he declined. After his discharge from the hospital, the patient visited the doctor monthly for 3 months and made an excellent recovery from scurvy at the 3-month mark. Unfortunately, after his recovery, he had a relapse of his alcohol use. He took a fall while intoxicated and died from cerebral hemorrhage. Interestingly, unlike most other animals, humans are unable to synthesize their own vitamin C. Most animals are able to synthesize ascorbic acid, which is also vitamin C, from glucose in the kidney or liver. And vitamin C is an important nutrient because is necessary for many enzymatic reactions in its role as an electron donor, and it is critical in the synthesis of catecholamines. And this case is important because it highlights the needs for all members of the medical team to reiterate the importance of vitamin supplementation as part of their routine care after bariatric surgery. And in addition, it also highlights the importance of routinely asking patients about their alcohol use because it can be extremely detrimental to their health. And the doctor did note that he felt he could have recognized his alcohol relapse if he did rescreening for his established patients. And that's it.